Now we'll check all the lymph nodes. First we'll check the pre-auricular lymph nodes, which are in front of the ears. The post-auricular, which are behind the ears. The occipital, behind the head. Submental, behind the mandible tip. Submental, did I say that? Submandibular, which is kind of in the middle here. Jugulo-digastric, or the tonsillar, which are here in the mandibular angle. The superficial cervical, which are right over the sternocleidomastoid muscle. Now, to find the deep cervical, we'll have you bring your head over to my side, so this side. There we go. And it relaxes the muscle, so you can kind of feel the deeper ones on the opposite side. Okay. So now we'll check the post-cervical, which is along the trapezius muscle. And then we can also check for the supraclavicular, which are here right above the clavicle. So that's good. Now we'll check the tracheal position. So we'll check and see if it's midline by putting one finger in the groove and kind of bringing it over. And then doing the same for the opposite side. So that's a good midline trachea. So next we can check the thyroid. It's another organ in the neck. So we can now do it in two ways. First we can do the posterior approach. I'll just come over here. You probably won't see me anymore, but we'll come over here. Okay, in the posterior approach, you put one hand right along the trachea and displace it to the opposite side. And then you kind of run your fingers along it on the opposite side. You can also have the patient take a sip of water. So here you go. When I tell you to, hold on a second, I'll displace the trachea. And then you go ahead and take a sip. Okay, and then the trachea thyroid does go up with swallowing and then comes down with rest. And then do the same with the opposite side, displace it, have them take a sip of water. Go ahead. And so you can probably even see it in the video, the thyroid does go up with swallowing. Okay. Now the anterior approach, you can use your thumb on one side to displace the trachea and then kind of pinch the muscle on the opposite side and check for any bulges. And then same on the opposite side here. So there's no bulges. And the last thing to do is to listen for bruit. So you're supposed to check it with the bell of the stethoscope. So it's normal to not hear any bruit, so that's normal, no bruits. So now it's important to teach our patients to do an examination on themselves. There's the easy one they can do at home. Usually what they can do is be in a well-lit room in front of a full-length mirror, and it's best to also have a handheld mirror. So the first thing they need to do is undress. And then you can check first your forearms, your palms, and the space between your fingers. Turn over your hands, look at the front and the back. So that's something that you can do. The next thing you can do is face the mirror and bend your arms at the elbows. And you can study your arms in the mirrors. The next thing you can do is also face the mirror, and then you can just study your whole body front. So you start at your face and your neck, and then you work down over your torso and then down to your lower legs. Just checking all the skin areas, make sure there's nothing new or anything that you didn't see. Now you can put your right side to the mirror, and you can also study the sides of your arms and keep going down to your hips and your legs, and then continue down all the way to your ankles. And then you can repeat it on the opposite side, the left side. So in the mirror, you can also put your back to the mirror, and then you can study your back, your buttocks, your thighs, and your lower legs for any lesions or anything that's new. Now you use the handheld mirror, and you can study your upper back, so you can use that mirror to kind of show to the full-length mirror your back. And then you can also use the handheld mirror to study your scalp. So you may not have a problem, but for women, they can use a blow dryer to kind of lift their hair up so that they can kind of see what's going on. Then the last part is to sit in a chair, just like you're doing, and then study the insides of each leg, and then the soles of the feet using the handheld mirror. So that way you can kind of check yourself for everything from head to toe. Okay? So that is the skin, head, hair, nails, and regional lymphatics assessment for Nursing 3066. And I'm Christine Rincon. Thank you very much.